Hello and welcome to Medical Dialogues. I am Dr. Garima Soni. Let's look at today's top medical news. Appetite control through brain stimulation, a groundbreaking approach to obesity treatment. Metabolic syndrome is a complex of multiple metabolic abnormalities, including obesity, high blood pressure, and high triglycerides, often caused by poor diet and lack of exercise. According to the World Health Organization, 1 in 8 people worldwide is overweight, making obesity treatment one of the most prominent markets currently. There are various types of obesity treatment, including drug injections and pharmaceuticals, but such chemical treatments often come with potential side effects which taken over for a long period. Accordingly, the team led by Dr. Ki Young Shin, the official name of the electrical stimulation technique is transcranial random noise stimulation. Through years of research, the team identified the possibility that non-invasive electrical stimulation of the dorsolateral prefrontal cortex with TRNS technology could induce appetite suppression. The goal of the clinical trial was to prove that TRNS stimulation is effective in reducing appetite. HIIT proven more effective than moderate exercise in post-stroke recovery. Limited evidence supports the effect of short-interval, high-intensity interval training for improving cardiorespiratory fitness after stroke. Hence, with this, the authors aim to compare the effects of 12-week of short-interval HIIT versus moderate-intensity continuous training on VO2 peak, cardiovascular risk factors, and mobility outcome among individuals more than or equal to 6 months post-stroke. This study was a multi-site 12-week randomized controlled trial with an 8-week follow-up. Participants were randomized into 3 days per week of HIIT with 10 into 1 minute, 80 to 100% heart rate reserve interspersed with 1 minute 30% heart rate reserved, or MICT, which is 20 to 30 minutes 40 to 60% heart rate reserve. Non-nutritive sweetener erythritol increases platelet reactivity and thrombosis risk. Study finds. Although artificial and non-nutritive sweeteners are widely used and generally recognized as safe, there have been no clinical trials to assess either long-term cardiovascular disease risk or short-term cardiovascular disease relevant phenotypes. Therefore, using a prospective interventional study design, the authors tested the impact of erythritol or glucose consumption on multiple indices of stimulus-dependent platelet responsiveness in healthy volunteers. Erythritol plasma levels were quantified with liquid chromatography tandem mass spectrometry. Platelet function at baseline and following erythritol or glucose ingestion was assessed via both aggregometry and analysis of granule markers released. That's all for now. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.